Ohio's channel for news. Serving Ohio for more than a decade, this is Ohio's 9 o'clock news from ONN.
Common gum disease can be prevented.
Coming up, the tools to fight the disease and the other health problems it can create. You're watching Ohio's only 9 o'clock news on ONN.
In today's Health Journal, in your mouth, your gums are an important foundation for your teeth and obviously provide stability for all of your dental work. But they are also like little windows that, if left open, can give bacteria a straight shot to your vital organs. Central Ohio dentist Gregory Janikian joins me now to talk about the importance of fighting periodontal disease. Thank you for joining me, Dr. J.
Thank you for having me.
Let's talk about this because it's something that as we age, most likely everyone is going to have some form of it, right?
Yeah, the numbers are interesting and almost sort of staggering in that 80 to 90% of our patients and everyone will have gum disease at some point in their lifetime. And it's just so important to recognize that and to make sure that we take care of that.
Okay, so let's talk about what periodontal disease looks like. We have a great comparison graphic of a good tooth or good gum area and a bad gum area. Explain a little bit about that picture.
You can see on the left side of the screen where the little circle is that's highlighting that space. Basically, gum disease is a breakdown of the seal that holds the tooth in the socket, and also, like you said, the windows, and it breaks down and allows bad bacteria to get into our body. On the other side of the screen, you can see the pink tissue, nice and tall. The bone is up higher, and that seal is maintained there.
Okay, and dentists like yourself measure the bleeding of the gums and how big that gap is. It's only a few millimeters wide that can let that bacteria in. And once it comes in, as I alluded to, it can go to the other vital organs and really impact us in other ways.
Yeah, we know there's a link between gum disease and heart disease. We know there's a link between cardiovascular disease, you know, your arteries and veins, and gum disease, and also pancreatic cancer, diabetes, low birth weight. We tend to go to the dentist and think about just our teeth, but really, like you said, it's a window to the whole body, and that's why if you go to the dentist and we're kind of pushing your gums, it's because we're thinking about more than just your teeth.
Yeah, my dentist is on top of me, and I'm really trying to fight it myself, but what can we do to fight periodontal disease?
The best thing to do is obviously preventative maintenance, flossing and brushing, and seeing the dentist on a regular basis. For some patients, unfortunately, it can be genetic. You can have a predisposition to these diseases, and it's just important to get regular care.
And get those checkups. We thank you, Dr. Gregory Janikian, for coming in.
Thank you for having me.
If you'd like a link to his website, just go to our website, onntv.com. You can learn more about how to fight periodontal disease. Click on featured links and we'll hook you up with Dr. J.